Join me as I dig deep into the surprising side effects of statins and see if I can uncover what your doctor might not tell you. Today, we're talking about statins, those medications that are supposed to help us lower our cholesterol levels and reduce our risk of heart disease. And, for many people, they do just that. But, what if I told you that there's more to the story? That, despite their benefits, statins can have some surprising side effects that might just make you think twice about taking them. When patients are prescribed statins, they're often not informed about the potential issues they might face. They're told that they need to lower their cholesterol, and that statins are the way to do it. But, what about the muscle pain, the cognitive issues, and the increased risk of diabetes? These are all real side effects that people are experiencing, but they're not always being told about them by their doctors. Take, for example, the story of Mary, who was prescribed a statin to lower her cholesterol. At first, everything seemed fine, but then she started to notice that her muscles were aching all the time. She couldn't even walk up the stairs without feeling like she'd been run over by a truck. And, despite her doctor's assurances that it was just her age catching up with her, Mary knew that something was wrong. It wasn't until she did some research on her own that she discovered that statins can cause muscle pain in some people. Many patients are not informed about the potential side effects of statins because, let's face it, doctors are busy, and they often don't have the time to go into all the details. But, that doesn't mean that patients shouldn't be told. We have a right to know what we're putting into our bodies, and what the potential risks are. And, when it comes to statins, those risks can be significant. In addition to muscle pain, statins have also been linked to cognitive issues, such as memory loss and confusion. In fact, one study found that statin users were more likely to experience cognitive decline than non-users. And, if that's not enough, statins have also been shown to increase the risk of developing type 2 diabetes. Now, I know what you're thinking, these are just a few isolated cases, but the truth is, these side effects are more common than you might think. Muscle pain, cognitive issues, and diabetes risk are all bad enough, but there's another side effect of statins that might just shock you. Did you know that statins have been linked to an increased risk of cataracts? Yes, you heard that right, cataracts. And, it's not just a small increase in risk, either. One study found that statin users were 57% more likely to develop cataracts than non-users. That's a pretty significant increase, if you ask me. This side effect is particularly troubling because, unlike muscle pain or cognitive issues, cataracts are often asymptomatic until they're advanced. So, people may be taking statins for years, unaware that they're increasing their risk of cataracts. And, by the time they find out, it may be too late. So, what can you do? The first step is to educate yourself. Don't just take your doctor's word for it, do your own research, and learn about the potential side effects of statins. Then, have an open and honest conversation with your doctor about your concerns. Remember, it's your body, and you have the right to know what you're putting into it. Thanks for joining me on this journey into the surprising side effects of statins. If you've had a personal experience with statins, please share it with us in the comments below. And, if you want to stay up to date on the latest health news and research we look into, be sure to subscribe to our channel.